everyone. I'm Dr. Patron Romero. I'm a psychiatrist working here in the movement disorder section. And today I would like to talk about a topic that is very important for everyone, including the Huntington's population, and that is sleep. So what is sleep? Sometimes we think about sleep as the time we go to bed and close our eyes until we wake up hours later. But in reality, sleep is part of this 24-hour cycle. During sleep, hormonal changes will take place and many things will happen to our bodies, from changes in our blood pressure, blood sugar, cholesterol, temperature, and just in general healing. So sleep is only one side of the coin. How we sleep affects how we feel when we are awake, and what we do while we're awake, from physical activity to diet, will affect the quality of our sleep at the end of the day. What are common sleep problems? Insomnia is certainly the most common one, the one that everyone knows the most. There's different types of insomnia depending on when we have the biggest problem with sleep. Initial insomnia, if the problem is falling asleep. Intermediate insomnia, if the issue is that we wake up in the middle of the night from our sleep and then it becomes difficult, too disruptive. Or late onset, when we find it challenging to wake up at the intended time because we might wake up 1 or 2 hours earlier and then cannot go back to sleep. Another common problem is sleep apnea. Sleep apnea is when we have challenges breathing as we should in our sleep. So our breathing is irregular. Sometimes we have to gasp for air. It's strongly related with snoring. So that's another common one. There's many reasons for sleep apnea. And restless leg syndrome, which can be related to different causes. It can be because we don't have enough of certain minerals in our blood, because we're taking certain medications, or just sometimes it happens on its own. So are sleep problems more common in HD? The answer to that is yes. Patients with Huntington's disease are in average 3 times more likely than non-Huntington's patients to report sleep problems. But we will talk about more about that average and how things are relative, because at some stages it is less than 3 times and in others it's more than 3 times, and even that 3 times reference point has to be placed into perspective. So do sleep challenges change over time? The answer to that is yes, and that is true for everyone, but more so in HD. So before the onset of physical symptoms of HD, sleep problems are more likely than in the general population. How much more likely? Well, about double, but that double actually means something very specific. So in HD studies, the prevalence in the general population is about 3%. And the prevalence of insomnia or sleeping problems in HD patients is about 5%. So general population 3%, HD patients 5%, which is about 1 in 20, and that's before motor symptoms. So you can say it's almost double or close to double, but that's still only 1 in 20 patients. And with time, the likelihood of sleep problem increases in everyone, but for HD patients continue to be higher. Now, will everyone with HD develop a sleep problem? The answer to that is no. Although much higher relative to the people without HD, up to 6 times more likely to be reported. In general, less than half of the patients with HD will report a sleep problem, regardless of the stage. So the highest prevalence of sleep problems in HD is 3 or 4 out of 10 individuals. That's when the risk of developing sleep problems is the highest. And in the general population will be something like 3 or 4 as well, but out of 20 or 40 individuals. So it's 3 or 4 out of 10 in HD, 3 or 4 out of 20 or 40 in the general population. And why do patients with HD have more sleep problems than non-HD patients? There is not just one reason, probably a combination of different factors to some degree. For example, higher daytime sleepiness is sometimes associated with depression, and that is true also for anxiety. And it's actually one of the diagnostic criteria of anxiety, these issues, this thinking and this anxiety that interferes with sleep. So because we tend to find sometimes more depression or anxiety in HD patients, um, sleeping problems are also more likely to happen. There might be a reduction of sleeping hormones. This goes back to the fact that sleep is not just a few hours when we're in bed with our eyes closed, but sleep is part of this bigger 24-hour cycle, and changes in certain hormones can affect our sleep. And moving, moving while falling asleep or during sleep, which can be the result of other disorders, like some of the ones that I mentioned before, like restless leg syndrome or sometimes something called periodic limb movement, can also be part of the picture on why these kind of issues are more common in HD. Now, how are sleep disorders identified? So self-report is the main and most important one. There's different ways of reporting sleep issues, from just a conversation with your doctor saying, look, I don't feel rested during the day. I'm always very fatigued. I'm having a hard time falling asleep, waking up in the middle of the night, waking up too early, to having a structured sleep diary. So sleep diary, there's many different ones. There's from the American Academy of Sleep Medicine. There's one from the Sleep Foundation. There's one from the NHS in the UK. And all of them can be helpful to really, really kind of get to the bottom of what tends to be the sleep problem that we're experiencing. We are really bad at reporting with a lot of exactitude how our sleep really is. We feel like we kind of know where the biggest problem is, but most studies finds that everyone is not good at reporting their sleep. So sleep diary can be a way of making a report more accurate. There's also other questionnaires that can tell us that there might be a sleep problem, like there's scales for how sleepy you are during the day, which usually reflects on some changes in sleep within your usual schedule. And then the other one is report by family members. One of the things that I mentioned was sleep apnea, which is often associated with snoring. So sometimes family members can inform us about that. And other forms are specialized studies, like sleep studies in a formal sleep lab, where you go there, you sleep there, and they're checking your oxygen level, how many breaths per minute you're taking, how much you're moving during your sleep, what your brain is doing while you're sleeping. And that's the most accurate way of really finding what's the sleep issue that you're facing. Now, what kind of sleep problems are common in HD? Well, this is similar to the general population. So insomnia and sleep apnea. Now, sleep apnea is not a simple disorder, but has some specific approaches in treatments, while insomnia can be immensely complicated with many factors causing it, contributing to it. And thus approaching it with different perspectives can be very helpful, from what your neurologist thinks, what your psychiatrist thinks, what the sleep doctor thinks. Putting all that together is a good way of really finding what's the cause of insomnia. Now, how are sleep problems in HD treated? Well, similar to the general population, changing sleep habits is the number one approach. There's this kind of specific therapy, cognitive behavioral therapy, that is provided by sleep specialists that is specifically tailored to insomnia. So, for example, one of the approaches is stimulus control therapy, where bedroom behaviors is limited to the most essential things that need to happen in the bedroom, limiting the amount of time we spend awake in our bedrooms. It's another thing that we try to control, promoting that the bed and the bedroom environment are tightly coupled with sleepiness and sleeping. So, for example, not using our bedrooms for exercising, or not using our bedrooms to watch TV or anything else, like being on our phones, playing video games, all kind of things. Now, restricting the total amount of time we spend in bed to the total amount of time we spend sleeping is very important. So if we're going to be in bed, is to sleep. And sometimes we might have these break sleep schedule where we go to bed, sleep for a few hours, we leave, we go back to the bed, we spend there like an hour awake, then we fall asleep. So trying to collect all those broken hours to just one block of time, and that block of time is just sleeping, just sticking to that until we kind of force our sleep schedule to follow that. That's another of the approaches. And of course, sleep hygiene, which means, avoiding caffeinated drinks later in the day, limiting the light emitting devices. Even if they have these blue filters, it doesn't matter. If it's bright light coming from anywhere, it's going to keep us awake. It's going to get into the way of sleeping. Having a good routine for sleep that is always very predictable and same, and mindfulness exercises that can help us kind of slower thinking and go to sleep. Now, medications is another approach. Medications, there's many different kinds of medications, and it all depends on what we're trying to specifically address during sleep. If it's initial, intermediate, late insomnia, etc. Sometimes more than one medication is needed. Sometimes the use of off-label medications, indications is an approach. Other times, medications are being used for a different purpose in HD, and they can be optimized to also help with sleep. And the use of assistive devices is another way of treating them, which includes from a CPAP machine, which is this mask, or sometimes these things that just go into your nose that help you breathe if you have sleep apnea, that gasping from air and snoring in your sleep, to something as simple as a white noise machine to kind of help you again stop thinking and ruminating and just try to fall asleep. So in summary, sleep problems are common in the general population, but have higher rates in HD, which can increase with time, although less than 50% of patients will eventually report a sleep problem. There are many forms of sleep problems, and just like there are many forms of sleep problems, there are many forms of treating those sleep problems. A sleep study is sometimes appropriate and can be very helpful in identifying and understanding what the sleep issue is, and thus choosing the appropriate approach. And sleep hygiene is an essential factor in sleeping well. And our bodies don't know about days of the week, and thus we have to always stick to a healthy routine when it comes to going to bed. It only knows about day of the time. Our body only knows it's getting darker now. There's a lot of light. It doesn't know that it's Friday and we're gonna watch TV until very late, and then we're gonna wake up late on Saturday. So how you sleep affects how do you feel when you're awake, and what do you do when you're awake will affect how you sleep. So it's important about thinking about sleep in this bigger picture about our 24-hour cycle, and always try to make it the same. And if we feel like we're not refreshed when we're awake, and we're constantly falling asleep when we're awake, it's a good conversation to have with your doctor to try to find out what the problem might be. So thank you for being here today, and I look forward to your questions.